It's radiation treatment day. Here's where I go. The cancer center at the Fairbanks Memorial Hospital. Except every day is treatment day. Like 5 days a week for 6 weeks. Yeah. Here I go again. I filmed this over several days, but I wanted to keep topics together, so it may feel just a little disjointed based on who's doing what. But I wanted to make it clearer about what's going on. Here. Let me grab a little robe. You go in the little room to get naked. I'm not going to video this part, sorry. I'm going to show you the little thing. Some cupboards, though. These are kind of cool. Place to put your purse, your sweater, and your jacket, and your glasses. Yeah. It's so flattering. So she's looking at my screen up there, deciding what all my little numbers are so that they put me in the exact same spot every time. You don't really need to know her name. What's your official title? What's your
I'm a radiation therapist.
Okay. You ready?
Ready for you?
Okay. I'm not worried about my boobs being out there. I just don't, Facebook and all that.
Oh yeah, they have all the things.
Okay.
Alright, tell me your name and birthday.
Pepper McFarland, 22368.
Sorry.
Oh, I meant my time. Yeah, because I was wandering around out there.
So when is it recording now or?
It is.
Okay, so it has time to like. Okay.
And I can.
So you just, yeah.
It's still a little glitchy.
It was, yeah. Okay. If I'm
I
noticing
don't care,
anything,
but-
okay. If I'm noticing anything, I'll say over the loudspeaker. I'll tell you when to hold it. Like if I see you coming in and then you're in between, I'll say hold it there, and then you kind of just like when you take the breath in, maybe just try to breathe in slowly, and then when I breathe in, just like you can. Okay.
Cameras that pick up on the block that sits on her belly, it moving up and down.
Oh, that's how that works.
So that's how that works. Yeah.
Take a breath in and hold it.
This is the device that I see. When he says take a breath and hold it, I have to keep that white line in that green box until he says to breathe. Otherwise, it turns the treatment off because they want my body to not move during the actual zapping. So he looks up at the screens over there that have all my numbers on them to make sure that we're lining up. And I have these little itty bitty new tattoos, one on my left side, one right between my boobs. That's my hand, not his. And then on my left side, or my right side, they decided to use a mole that I already have as the lineup. So that's how they line up to make sure that I'm sitting on the table just right. And you'll see here he's adjusting me, just using the sheet to move me a little bit to the right so that I line up just perfectly.
Oh yeah, yeah. No, that's perfect. Good. Alright, we're gonna get started. Hold nice and still, be right back, okay? And take a breath in and hold it. You can breathe.
There is a lot of just waiting time. I know that they're changing the settings and repositioning the machine, and there's just the whole process probably takes maybe about 15 minutes, less if they're both working at the same time, but oftentimes they have other duties that they have to do. So yeah, you just lay there and stare at the little screen and listen to the music. It's not bad. I have edited out a lot of the really long pauses, so it's, a little longer than what you're seeing here, but not a lot. I wonder how much this machine costs. I think like $1 million or $2 million, something like that. Those really are the kinds of things to think about while you're just laying there staring at the little screen. The camera view that you see of the breathing machine, we put the phone right next to my head. So it was on a different day than the video you're watching of the machine moving. So it doesn't match up perfectly, but I wanted you to see that that's what I see and that's what I do.
Take a breath in and hold it. Breathe. Take a breath in and hold it. Breathe. And when you're ready, take a breath in and hold it. Breathe.
So this is what it looks like when the machine moves around me from my view.
Take a breath in and hold it. Breathe. Take a breath in and hold it.
And breathe.
I really hope they don't give me a hard time about the music in here because there isn't anything I can do about it. It's the hospital's music. It's just playing. Yeah, it's pretty good, but it's not like I can turn it off or I can turn it down because then you can't hear what's going on in the room because, you know, it's coming through the ceiling. Just like the lights. The lights are pretty cool, aren't they? They fade in and out and it's nice and pretty and yeah, that's nice.
Take a breath in and hold it. Breathe.
So what he's doing here is I think the next little piece of this they can't do using their guidelines. So what he does is he takes a marker and he draws this line on my chest every day. That's a little faded there because I washed. And that's where they line up the next set of treatments to, is that line. If you watch at the very bottom of this screen, you can see Kelsey drawing on in the reflection. Watch.
Take a breath in and hold.
See right down there at the bottom, that's her drawing on my skin. But they have something to line up to, and then in a second they'll line up. You'll watch him doing it.
Breathe.
This thing he's putting in there right there has a giant piece of lead on it that is shaped just like my little treatment thing, and it's got my name on it, so they must remake that piece of lead for every particular person to make sure it is aiming exactly where it's supposed to. Again, he's checking my numbers to make sure they all match up exactly like they're supposed to.
So this is it's like a lead cutout. So this is lead. This will stop all the outside here. That'll stop any electrons from going through. So only the electrons going through are in this little hole.
Okay.
So it does, in a sense, focus it. So
Okay.
all electrons are just coming out of the machine.
Protects the rest of me.
And protects the rest of you, exactly, and
Got
shapes it to where the doctor wants the
Okay.
radiation to go.
Take a breath in and hold it. Breathe.
They have me loosen my pants so that it doesn't restrict my breathing enough. So when I hold my breath, it works great.
Yeah.
Okay. This is the fancy little control room where they do all of their stuff. And
So this is you. You're pulled up on this screen, so I'm able to go
you
in
can see my
between-
picture right there.
Yeah, that's me. That's you. So I can go in between each field size. You've already gotten your treatment today, so there's green check marks next
Okay.
to all of the areas that we've treated today. And then, but to start your treatment, we went and we took an MVKB. We took an AP field and a lateral field of view.
Okay.
And I was able to go through and match the two. So this is the picture that we took today.
Okay.
This is the AP of what we did in CT, the AP of you laying
Okay.
down on the table, that very first.
Right.
So there's an AP of it. So you can see your humeral head, your supraclav, your ribs, your breast tissue, your heart.
Okay.
And then lateral view, your sternum, your clavicles, your spine. I'm going to match your sternum with your breath hold.
Okay.
There.
Oh yeah. Uh-huh.
And your arm is going in and out.
Okay.
And your breast tissue is right on, right?
Okay. And that's how we line it all up to make sure that we're zapping the exact right
That's
spot.
how I get really close.
Okay.
Right? And then I'm gonna take what we're treating. So this is an actual field of what we're treating.
I'll move the chair.
See the blue?
Yeah.
That's the field. That's what the field is gonna look like
Okay.
coming out of those little MLCs that, I'll pull it up here. Can I? I will in a second. So now I'm matching your tissue. So I can click and drag and I can treat however I want to treat.
Oh.
But I want to make sure that I'm lining up. You see the green
Yep,
tissue?
yep.
I'm going to make sure that that is on there. And,
And
then
this right here is the thing we're treating, right?
this whole blue
Oh,
square
okay.
is what we're treating.
Oh, okay.
The
So what does happen? All of it.
Your entire
Okay.
breast is what we're treating. And I'm going to make sure that I'm not on your heart, right? We're close, your left side.
Okay,
This
right,
is the edge
yeah.
of your heart. So I'm going to make sure that I'm treating all of my contours. You can see my blue line move.
Yep. Yep.
I'll turn my DRR1 off. Didn't turn it off. Oh, it won't turn off.
Okay.
There it goes. So you can see I want to make sure the blue line is off of your heart,
Yep.
and I'm covering all of your tissue. Those BBs, that's the BBs that we put
Mhm.
that they had marked. So whenever we do your boost and for treatment, we can see we're
Right.
right on. Right?
Okay. Okay.
So this is how you were laying on the table today.
Okay.
This is how you were laying on the table for the CT sim that we
Okay,
did several
got it.
weeks ago.
Right.
So
okay.
they made the plan from that. I need to match the two. I need to make sure that I match the two. You remember your blue box?
Yeah.
So that's your blue box.
Okay.
So all of these will close on the machine
Down to that.
down to, you see those finger-like projections? Those
Yeah. Watch
MLCs?
that thing happen.
Go inside the machine.
Yeah.
That's us. That's, you're seeing it move here. And then it closes in, and then it's ready for treatment
Exactly.
if you're up
Okay.
in the position.
So instead of watching the little screen this time, watch what's going on below it. See the little rods in there moving? That's that thing she was talking about where it's making it just the exact shape to get my boob, but not my heart. See little rods in there moving? Yeah, that's that. Okay.
And then these were my shifts. So I moved my box, and we're going to the 10th of a millimeter. So the table went up 0.07 millimeters, went out 0.16 millimeters, and went to the left 0.07 millimeters.
Okay.
And then I applied those shifts, and it moved your couch. You
Right. I
felt
felt
the
it
couch
move. Yeah.
So it moved the couch to know that I'm on exactly where I want to get treatment.
Okay. I think
And
it's
then I
funny
go
that you call
for
it a couch.
It's a couch.
Not that comfortable.
No, it isn't. Alright, done. You put your laundry in there. This is the waiting room, little TV. It's snowing outside. Puzzle people either when waiting, and occasionally I end up in here, you know, after, just for a couple of minutes. And I'm done for the day. That's it.